Welcome to Gate City Insider. I'm Rosemary Plyben. 36 years ago, 14 friends got together in the Triad to talk about an emerging health crisis. A number of their friends had HIV or AIDS, and healthcare and support were frankly hard to find. Those friends were the start of what is now Triad Health Project. Adriana Adams joined THP a couple years ago and took over as executive director earlier this year. Welcome. Glad to have you with us.
Thanks for having me. I'm so glad to be here.
So can you talk a little bit about how the work of Triad Health Project has evolved over these 4 decades almost?
Great. Yes. You know, I think you did a great job of talking about how this work developed, and that really when we began, it was about crisis management. I think we've learned a lot about crisis management in the last couple years, especially when it comes to infectious disease. People are suffering, people are hurting, and the time it was the goal just to make sure that people were really dying with dignity. But over the years, medicine has evolved. What we know about HIV and AIDS has evolved, and so our work has evolved at Triad Health Project. And it's turned into looking at people and saying you can live a whole, full life if you have access to medication, if we can accomplish overcoming some of the barriers that people face in our society to accessing healthcare. And so our work has evolved to providing some of those access points, to making sure that people, if they need it, have a case manager to help manage their HIV, and making sure that we're providing STI testing, pregnancy testing, and that all of that is free to the community. So that's been the biggest evolution in our work.
So really at the beginning it was reactionary, and what do we do? And it was scary. I mean, you and I both grew up around that time and remember hearing about it, and it was mysterious and scary, and there was so many questions around it. Now we know so much more. So now it's a holistic approach to taking care of those who have it, preventing it, having the conversations. So dive into a little bit more of the services. You talked a little bit about the testing and the support.
Yes. So for people who are living with HIV, our organization provides case management for those folks. So that might look like a number of different things. For some people, that's really wraparound services and support. But really, whatever it is, it's meeting people where they are. Some people want to have a full-on relationship with a case manager, where they're really meeting with them fairly often, high-touch services. Some people just want to meet with someone once a month and check in with them. And that's in partnership with a doctor, most likely with our partnership with Regional Center for Infectious Disease at Cone Health, which Cone Health is a great partner of ours. And then for some folks, it's just, I need some groceries this month. I might need some help with making sure I have reminders for my medication. And then the other thing that we do is, which I spoke about, was our prevention services. So we're providing testing for HIV, syphilis, which that's with a blood draw, and then we're providing testing for gonorrhea, chlamydia, and hepatitis C, and pregnancy. So we also provide pregnancy testing. The other thing we do is people can access safer sex supplies at our office at any point. We also have a little bin outside of our office. People can just come by and pick up condoms of all kinds and lube at our office. We want to make sure that people have access to the supplies they need to have safer sex.
What is the face of HIV and AIDS in our community?
That's a very interesting question, Rosemary. So I'd like to answer that in 2 different parts. The face of HIV is our faces, right? Folks who are living with HIV look just like me and you. They could be someone who is providing you support at a hospital. It could be someone who is checking out your groceries at the grocery store. People who are living with HIV are at all socioeconomic levels in our community, because thanks to modern medicine, people who are living with HIV are living full lives. People at our agency that work for us at THP are people who are living with HIV. However, another important part of that is that just like with other infectious diseases, HIV has also gone and settled into the margins or the marginalized in our community. So we've seen that with COVID. We've seen that with other infectious diseases. So where there are barriers to healthcare, where there are issues with access, that's where HIV goes and it stays. And so what we see right now is that our new cases, where there are a rise or a higher percentage of new cases, are in communities of color, communities where there are lower socioeconomic statuses. And we also see that within, particularly where there's any intersectionality of those things. Mm-hmm. So our highest numbers are in communities of color and men sleeping with men, mm-hmm. or women of color. Those are the newest cases. So that's in my community, the Latina community, and also within the Black community as well. And that's where we want to get in and have education, spread the news about what we do here in Guilford County, and make sure that it's not about a deficiency, it's about access. Mm-hmm. So there is nothing wrong or different about our bodies. It's about what's provided in those communities. And so that's what we're doing at THP.
And it's about education.
Yeah.
I mean, that's so key. You know, I worry that some people hear HIV/AIDS and they say, oh, that doesn't apply to me. I'm not listening anymore. But it's so much more than that, because it's STIs, and it's about education, about sexual education and children, and we all need to know how our bodies work and yes. how they work with other people's bodies.
Yes, it's about that, and it's about, making sure that we have the conversations and we stop the stigma surrounding these issues, especially in communities where stigma has followed mm-hmm. these issues. And that's really true of communities, all communities, but particularly communities of color.
Mm-hmm. And that's a lot of the work, is stopping the stigma. We saw part of your website is devoted just to that. Is talking about it, and mm-hmm. and you actually give conversation starters, which I love.
Yes, we ran a campaign a couple of summers ago, actually right at the start of COVID, and we'll probably do it again, called Stop the Stigma. Mm-hmm. The first 3 letters of stigma are STI, so it was a really wonderful way to kind of bring those things together. Where we encourage people to have these conversations, that the first step is really talking about it. I realized when I took the job at THP that I had not yet had a conversation with my children, who were younger at the time, about HIV. And when I was explaining my work, I went, oh, this is a deficiency in my own parenting, mm-hmm. And I really stepped into that and said, we talked about sex, but we had not talked about HIV. We had not talked about STIs yet. And that was an important step for me to take as a parent, and to really take that on and say, here's an important piece for me to do with my own family, mm-hmm. and to encourage other parents, to encourage other people in other people's lives to say, let's have this conversation. Why am I not having this conversation? What's this danger I sense?
Right, it's hard.
Yeah.
I mean, thinking about it is hard. Is the actual doing it as hard as the thinking about doing it?
Yeah, I think if we don't know how to start that conversation, mm-hmm. which is why we developed some conversation starters, I think what's hard is thinking that is the possibility of one day my child having an STI, particularly mm-hmm. HIV. And so we get concerned that somehow having the conversation, it's that imagining in our head, this narrative we build in our head.
It's going to make it happen.
It's going to make it
right.
happen, when really what it leads to is prevention. Mm-hmm. And that we also recognize our own limited knowledge. What don't we know? And so one thing that we provide at THP is we will give an HIV 101 to anyone who wants it. We will go and we will hold it in our office. We will go to a place of worship. We will go to your club, whatever. We'll come to a family and do an HIV 101 and just teach the basics on what is HIV, how do you get HIV, how do you not get HIV, mm-hmm. which is just as important. We will teach about safer sex supplies and offer those at the gathering. So that's something that's available to anyone in the community for free. And we love it when people contact us for HIV 101.
That sounds like a really good time to talk about what do we not know, because it has been around for a while and people think, oh, I know about it, but yes. a lot has changed.
Yes, a lot has changed. One of the big things that has changed is that there's a medication called PrEP, pre-exposure prophylaxis, that someone can take if they do not have HIV already. and it prevents the transmission of HIV at an over 99% rate.
That's unbelievable.
And it's something that we offer in connection with an agency or an organization called Q Care Plus. It's a telehealth organization where they're a community-based organization partner in North Carolina, and anyone can go on our website and access it and start taking PrEP for free. And then they don't have the risk of contracting HIV, especially if you're in what we would call a higher risk category. If you are having sex and you are in a certain age range, or you're someone who is a man sleeping with a man, or you could be someone who is sleeping with someone who is a man sleeping with a man, that is a category you have no reason not to go on our website and access that for free in connection with us, and we would love it if you would.
Yeah. What are some other misconceptions about HIV/AIDS?
Some of the misconceptions are how you contract it, again, how it's spread through the community. You're not going to get HIV through contact you might have with someone in a club. You're not going to get it at a family gathering. You're not going to get it through sharing utensils or hugging or kissing. So those are some things that still, are misconceptions and linger from, I think, back when, maybe when we were growing up. And they impact the people who are living with HIV to this day, family members that they have. It's one of the reasons why folks who are living with HIV don't share their stories, because they have such high concerns. They're often ostracized from their own families. Families don't want to have them over for dinner and share plates. They'll have a whole set of plates and then they'll get a paper plate. And that actually has happened to people, and it's one of the reasons at our Higher Ground Day Center, which is a place people living with HIV in our community can come and find camaraderie and a place to be during the day. We use real plates, and we have a place where people can just go and find community and can be with other folks who are living with HIV.
So important. We talked about that. It's so much more, I think, since COVID, just how important community is, how much contact with people, seeing people, touching people is important. What are ways to support Triad Health Project?
I think one of the biggest ways is giving. So much of our work is work that is supported through community support and giving, general contributions to our work so that we can continue providing the prevention support. Our case management is generally supported through grants that we receive, great partnerships that we have with Cone Health Foundation, United Way. They support that work. But our prevention work is harder because we're not really connecting that work to things like ending poverty, because we're not asking people for financial information when they come in. We think it's really important to make sure that anyone who comes in is able to access that free testing. And we know that many of the people who do come in need it to be free. We also don't want to ask people for ID. We want to make sure that it's just anyone who comes in. We also know that right now, free pregnancy testing is extremely important, and access to free condoms is extremely important, more important than ever, perhaps, in our community. And so we want to continue that effort to keep things free and accessible to anyone who needs it, regardless of where they come from. So giving is important. Volunteers to support the work. We have a handful of people who are providing all of that testing in our community, going out and partnering with colleges, being on site. And so on-site help is great. Providing meals at our Higher Ground Day Center. We have a meal provided every single day, 5 days a week. Lunch is provided there. And so if you want to provide a lunch, get in contact with us. If you want to serve there, get in contact with us. And then every year we raise over $200,000 of support at our Red Ribbon Run, and we do that through people signing up with teams. We even did that through COVID. And so if you want to get in touch with us for the end of the year, it's done during World AIDS Day, December 1st. That's a great way to support us.
Lots of ways to help, and at your comfort level and what works for you. If you want to find out more, if you want to support Triad Health Project, or if you need support yourself, the place to start is triadhealthproject.org. guilfordgreen.org. So thanks so much for spending some time with us.
Yes,
we really
thank you
appreciate
for having me.
Okay, when we come back, we are going to talk about Greensboro Pride and the work the Guilford Green Foundation is doing in our community. Stay with us. We all want to feel loved and accepted, right? Valued, all of that. That feeling is really at the core of Guilford Green Foundation's work. The organization works to unite our community and support and advance our LGBTQ friends and neighbors. Jennifer Ruppe is Executive Director here today with us. Hello and
Hi.
welcome.
Thank you for having me.
Really glad to have you. So Guilford Green started in 1995, initially to support Triad Health Project, and we just talked with Adriana about that, which I think is an interesting tie. How has it changed throughout the years?
Well, it's changed a lot. You said 1995, and that's true. Just like Triad Health Project, a group of friends got together and said, let's raise some money to help people living with HIV. They threw a couple of parties, 95, 96, and 97, called the Green Party. And they were raising money for Triad Health Project, and they said, well, maybe we can do more than that. Maybe we can incorporate and become an actual foundation and then be here forever to serve the LGBTQ community with funding and now with programs. So for the first 20 years of our existence, we were a foundation, one of the oldest in the Southeast, actually.
Wow.
That is a foundation specifically to fund LGBTQ issues. So that was incorporated in 1998. So that's when we became an official organization.
So the vision is to see a greater Greensboro with a thriving LGBTQ community that elevates all. I mean, and I like the all part of that.
Yeah.
So how's it going?
It's going pretty well, actually. I think we opened the center in 2018, and so when we opened the center, that's the first time Guilford Green Foundation was really able to provide direct service programming to the LGBTQ community, and it opened up our work, and it opened up our accessibility to the community to meet the needs that are the most emergent in our community today. So it allows us to work with LGBTQ youth and the transgender community in ways that we had not previously done before. And, you know, along with that, we still get to be that group of friends that started out fundraising for great causes.
So what happens at the center? We're seeing some video right now. Tell us about that.
So we have programming at the center. We have youth programming has been very, very popular. LGBTQ youth need us more now than ever. So just about 6 days a week, we have some kind of programming from 6 to 8 p.m., whether it be for youth, whether it be for LGBTQ seniors or queer people of color also have programming at the center. We host a LGBTQ affirming NA and AA group. So there's a little something for everyone at the center, and that's really our goal. When we talk about uniting the community and creating a Greensboro that elevates all, we want to be a place where everyone sees themselves and everyone finds something for themselves.
Talk about some of the successes you've seen over the years.
I think our biggest success that we've seen since 2018 when we opened the center was building the new center downtown. When I started in 2018, the board said, we got to get this center open. And so we did. We opened a center in a location off of West Bessemer Avenue. And it was fine that the board said, we're going to outgrow this so fast. And I said, okay, give us a few years. And they said, no, let's start fundraising now. And I will admit, I was a skeptic on how quickly we could raise money, but in a very short 5.5 months, we conducted a capital campaign, raised over $150,000, and completely rehabbed a downtown location space for our new center. And that's where most people see us now. We're so much more visible in the community now that we are in that downtown location. But gosh, that's just been a huge, huge accomplishment for us in the past 5 years.
So what are some of the challenges?
Well, the challenges are the political environment that we live in right now, especially for LGBTQ youth, and even more specifically for trans youth and trans people in general. We're seeing attacks at, as local as our school boards, trying to ban books that have anything to do about gender and sexuality or sexual orientation, all the way up to, federal legislation that's happened over the past 5 years to try to ban people from just being themselves, just living their authentic lives.
And do you think it's based in fear or misconceptions or not understanding?
I think it's probably a little bit of all of those things. I think fear and misunderstanding has a lot to do with it. And that is unfortunate because it's really harmful especially really harmful to our youth.
And that's what we're talking about. We're talking about people.
Yeah, we're talking about people.
That's what I think gets lost sometimes. It's not issues. It's people.
Yeah.
And that's the key. So we talked a little bit about the LGBTQ Center. Talk about getting involved. How can people get involved, whether they're part of the community, whether they just want to support the community?
Yeah, well, and uniting community means that we want to unite the whole community.
Right.
We want our allies with us just as much as we want to be a place for LGBTQ people. So the easiest thing you can do is just walk into our center, just knock on the door and come in and meet us, take a tour, see what happens at the center, come to a Green Queen Bingo event. That is one of our largest community events.
That's been going on a long time,
It's been going on for nearly 20 years.
Yeah.
This is a long time.
An institution.
It is an institution. We can't prove it, but we think it's one of the longest running in the country. I mean, that's a long time to run an event. It's every other month on the first Friday, and that is at Piedmont Hall at the Greensboro Coliseum.
And what is it? For those
It is drag queens and bingo. That is it. Brenda, the drag queen, is our MC. She hosts a great game. It is literally traditional bingo with your bingo daubers with drag queens performing in between.
It sounds like a lot of fun.
Yeah, it is.
So what are other ways to get involved if bingo isn't your thing?
If bingo is not your thing, come to a program, volunteer at the center, just follow our newsletter just to learn more about what's going on in the community. We share resources and programs that are happening in our community and resources. So everyone knows someone that might need a resource, access to a doctor, a lawyer, a plumber. We like to tell people that those resources can be found in our resource guide. So whether you're looking for community or resources, like us, follow us, social medias, come to an event, come to the center. All of those are great entryways to start to get involved with us.
So what is next? What's next for Guilford Green Foundation?
Wow, that's a good question. Next year is our 25th anniversary.
Oh, wow.
So we have an endowment, which is also a very rare thing for nonprofit organizations of our size. And so we want our endowment to hit $1 million, and we want to give our $1 millionth dollar in grants out next year. We're just over $900,000.
Oh, wow.
So on both of those indicators. So we really want to celebrate our 25th year with more programs, more grants, and just for us a huge community celebration.
And I guess that, speaking of community celebrations, we're in July, so
Yeah.
last month was Pride Month.
Yes,
But it's not just one month. You know, there's a lot of things that happen during Pride Month.
Yes.
But this work of Guilford Green and other organizations goes on year round.
It does, yeah. During the entire year, we serve nearly 5,000 people through the center, and that's not even including all the things, like that doesn't include bingo, it doesn't include Pride Nights at the Greensboro Grasshoppers, or all the other ways that we partner with communities, the community organizations and businesses to bring people together just to learn a little bit more about us and find a little bit of support. So we are out in the community 12 months out of the year.
Not just in June.
Not just in June.
Definitely not. Hey, thanks for spending a little time with
Thank
us
you.
today. If you want to get involved, of course, you can attend an event. If you want to support the cause, the easiest place to start is guilfordgreenfoundation.org. And we really appreciate you spending some time with us. Well, that is our time today. Thank you for spending a little of yours with us. Until next time, have a wonderful day.